Lethal diseases. Lethal diseases pose a significant threat to global health, affecting millions of individuals and impacting societies at various levels. These diseases, characterized by high mortality rates, encompass a range of infectious and non-infectious conditions. Understanding the causes, effects, and preventive measures associated with lethal diseases is crucial for effective public health strategies. Infectious diseases, such as HIV, AIDS, tuberculosis, and malaria, represent some of the most lethal health threats worldwide. HIV/AIDS alone has claimed millions of lives since the epidemic began in the late 20th century. Despite advancements in antiretroviral therapy, access to treatment remains a challenge in many low-income countries. Tuberculosis, another major infectious disease, is particularly dangerous due to the rise of multidrug-resistant strains. Malaria, primarily affecting tropical regions, continues to be a leading cause of mortality among young children, despite the availability of preventive measures like bed nets and vaccinations. Non-infectious diseases also contribute significantly to mortality rates. Conditions such as cardiovascular diseases, diabetes, and certain cancers are leading causes of death globally. Lifestyle factors, including poor diet, physical inactivity, and tobacco use, have exacerbated the prevalence of these diseases. Cardiovascular diseases, for example, are responsible for approximately 17.9 million deaths each year, making them the leading cause of death worldwide. The effects of lethal diseases extend beyond individual health, impacting economic stability and social structures. Families often face financial hardships due to the high costs of medical treatment and loss of income when a family member falls ill. Moreover, communities can experience a decline in productivity and an increase in healthcare costs, straining public resources. In regions heavily affected by lethal diseases, such as sub-Saharan Africa, these challenges can hinder development efforts and exacerbate poverty. Preventive measures play a vital role in combating lethal diseases. Vaccination programs, for instance, have proven effective in reducing the incidence of many infectious diseases. The Global Vaccine Action Plan aims to ensure that all individuals have access to vaccines, which can save millions of lives. Additionally, public health campaigns promoting healthy lifestyles can mitigate the risk of non-communicable diseases. Encouraging physical activity, healthy eating, and tobacco cessation can significantly reduce the burden of diseases like diabetes and cardiovascular conditions. International collaboration is essential in the fight against lethal diseases. Organizations such as the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, work to coordinate efforts, share research, and provide resources to combat health threats. Furthermore, global initiatives like the Sustainable Development Goals emphasize the importance of addressing health inequalities and ensuring access to healthcare for all. Lethal diseases remain a pressing concern for global health, with far-reaching implications for individuals and societies. Addressing these diseases requires a multifaceted approach, including prevention, treatment, and international cooperation. By investing in healthcare infrastructure and promoting public health initiatives, we can work towards reducing the burden of lethal diseases and improving the overall well-being of populations worldwide. Ultimately, the fight against these diseases is a collective responsibility that demands urgent attention and action.